Good evening. Welcome to Sound Health on Lagos Television. I am Olasumbo Modupe. We bring you Sound Health every Tuesday at 6:30 p.m. and we enlighten members of the public on trending health issues from around the world. The race between the ongoing Ebola outbreak and medical innovation is once again taking center stage in the Democratic Republic of Congo. This is our focus today. We continue shortly in a moment. Please stay tuned. It is a race against time for medical teams on the ground. But what does this trial phase actually tells us about timeline and efficacy? We have Dr. Kolawole Oladipo, an associate professor of infectious diseases, molecular virology, and genomics. He is also the founder of Elix Biogene Institute. Good evening, Dr. Oladipo, and thanks for joining us.
Yeah, thank you so much.
All right, Dr. Oladipo, what is the current update regarding the Ebola virus outbreak in DRC?
Yeah, for now, we have a lot of things going on as regards the Ebola outbreak in the Republic of Congo. It looks as if the media is silent about it. But as of today, which is 13th of August, we still have the Ebola. The current species of the Ebola we have is the Burgundio, and it's not Zaire. And since the time that it has been identified in the province, or Ituri province actually, we have noticed that Uganda have already reported a cross-border case of the Ebola virus. And actually, from the data as at August 9, 2026, there is an intense and expanding transmission. And currently now from WHO, from Africa Regional Source, we have more than 2,000 that have passed away. And since we only have it is days after the outbreak. So it has also been described as the largest recorded Burgundio virus outbreak. And it's also the second largest Ebola disease outbreak ever recorded after the 2013 to 2016, I guess, West African pandemic. So, what the major thing that made this case to be very, very complicated has been by humanitarian challenges and insecurity, then population movement and trade. So making the surveillance and access to affected communities so very, very difficult. So that is that. And we have seen a lot of effort being put in place for the vaccine development. I think the latest news I know is that a group of scientists from Oxford have developed candidate vaccine for the Burgundio virus, the strain of that Ebola. And currently now they've passed the preclinical stage and they've moved into the clinical trial phase 1. I think one individual has been injected for the trial. I think in a couple of days, there is going to be results being shown to people to know what are the safety profile, what are the immunological profile. Maybe it's going to make people to be protected from the virus. So that's the state of things that we have. And I know African CDC is trying to coordinate the responses from African perspective too, to see how things are moving in DRC.
Thank you so much for that enlightenment. Is this rapid spread driven by mutations?
Well, I have not seen, I can't really say because my team here too are working on something. But, virus mutation is something we need to look at it. Uh, it's an RNA virus, and it can contribute because uh, from previous one, we have seen Ebola. It has been a factor, but when we come to mutation, some of the time, mutation doesn't mean it makes the disease to be more virulent. Some of the time, mutation can occur and make a pathogen to lose its virulence. So there is no scientific evidence currently that I have laid my hand upon to substantiate that mutations is to an extent responsible for the rapid spread or the clinical severity of Burgundy Ebola outbreak. As of the limitation of my knowledge of today, because scientists are working and other things can come up with it. So this is something that we know. Though genomic determinant has a role to play in epidemiology of viruses, but currently now we need more evidence. But what we have known more is human movement, the delay in detection of the pathogen, then healthcare access, then the contact pattern, and the community trust. Because we have seen that most of the community members do not even believe that the pathogen really exists, or assume that it was a group of people that did introduce that pathogen into the community. So those are the ones that has been scientifically been established for now.
The World Health Organization says the Ebola outbreak is on track to be the deadliest ever. The current outbreak has seen over 4,000 cases and caused more than 2,000 deaths. Should we be worried, Dr. Oladipo?
Yes, I think we should be worried, because if 2,000 people can die in a community, what was the population of DRC having 2,000 people that died? And what is the percentage of those who recover? Actually, some recover, but you can't compare the number of those who were dead by those who recover. And that is something that we can do. It's not that we should fear, but it is something that we need to get prepared for and to guide against, at least maintaining transborder transmission and ensuring that it does not really happen or occur at all. And those are the things that we need to work with. When we have a situation like this in Africa, it comes in different with different dynamics, and those are the things we need to understand. And that is a collective effort, and we need every support from every angle in ensuring that we stop the spread of this pathogen, and we can halt it. Though, if early detected, there won't be so much death like this. And there's some news I've read that you see the healthcare providers, they are not happy based on the kind of resources they are working with and every other thing. So these are things that we need to understand and need to work on. So WHO may have that, but I think the responsibility belongs to every one of us in ensuring that we stop the spread of this pathogen.
What is the earliest timeline for the vaccine trial, Dr. Oladipo?
Yeah, I think is a vaccine candidate, and the animal trial results, based on what was discussed, looks promising, and that is why it was moved on to human trial phase 1. Most of the thing we'll look at in animal is safety first. Then after safety, we look out for immunogenicity. And it doesn't guarantee that if it passes the preclinical trial, it's going to pass phase 1. But it's promising, and it's something because the group that worked on the vaccine candidate development have had experience, and they have worked on previous pathogens like SARS-CoV-2, COVID-19. So they're using the same workflow and pipeline to work on these. Based on their previous experience, we are hoping that something meaningful will actually come out. My only concern is that we are not seeing support for African scientists to also come up with some of all these things too. And you see, most of the problem happen in Africa have to be solved by the Western world, and that is a big headache for some individuals like us. We have to wait for them until such a problem has been resolved.
In the absence of a fully approved vaccine, what clinical management protocols must be in place?
Yeah, I think for me, preventive measure is very, very essential for us to do, because if we can prevent, if we can do community sensitization, if you can do early detection, if you can carry out isolation and specialized care, then if you can give optimized supportive care, if you can do a good surveillance and a good contact tracing for everyone that have got in contact with somebody that has been suspected or confirmed, I think all this one will help. And if you can solve the issue of the insecurity that we have there, and all this can also be achieved if we have the capacity to do what we call community engagement and risk communication. So that will work with the community so that we can improve early reporting and acceptance of care. Then they can also adhere to outbreak control measures. All these will really help. Then look at their culture in terms of dignified burial services. So if they can have understanding of it, and that will reduce transmission, because we have also evidence of transmission from diseased patients. So if they can put all these measures in place, I think it is better. This will help us to have something to do before the vaccine will be coming out, and it's going to reduce the transmission risk of the virus.
All right, I would like you to remind viewers about symptoms to watch out for, to report at the nearest health facility. I know this will encourage containment.
Yeah, enough for now, because we really don't have any imported report cases of Ebola in Nigeria, based on measures that we have put in place in our land port, seaport, and at our airport. So from the port head authorities, have traveled, international travel, I've seen how they are checking temperatures, doing all those things. Kudos to them for what they are doing. So most of the symptoms are almost the same. We have early symptoms like fever, headache, muscle pains and joint pains, loss of appetite, and sore throat. But what I do tell people is that some of the time, symptoms of diseases are always very similar, but we need to go to the clinic to carry out laboratory investigation. So from there, we can confirm if truly it is Ebola or other thing. But there are some other symptoms that can develop later after early symptoms like vomiting, diarrhea, abdominal pain, then skin rash, and also when it comes to advanced stage 2, it can lead to kidney or impaired kidney or liver function. So, and we have seen cases where some patients do really have internal and external bleeding, and but bleeding is actually less common than many people assume. So it's less common. So these are the signs, but signs alone, clinical signs, symptoms alone, rather, cannot confirm Ebola. So it is laboratory testing that can actually confirm Ebola. And that's why they have to do molecular diagnostics in confirming that truly, after sample has been obtained, that this person is suffering from Ebola virus disease.
Kindly share tips to embrace to check further spread of the Ebola virus in DRC.
Yeah, it's just if you have your symptoms, go to the hospital, and if you uh, have gotten in contact and close with somebody that has been diagnosed or confirmed positively, you should be able to go through the isolation procedure to know that if you're going to you're a carrier, things like that. So it's just everybody to be truthful. Like I did say, if you are feeling informed at the entry, at the port entry into the country, but sincere with whatever information is requested from you. So don't lie, give the correct address. If we are having any clinical symptoms or signs, take it that this is what you're having. So it was going to help. So it's not about you anymore. It's about the entire community. So, and it doesn't mean that you have the freedom is there for you to do. So your freedom should not be a threat to other people in the community. So we need to be sincere as much as possible we can. Don't give fake address, don't give fake report, and declare what's expected of you at the point of entry to the country.
All right, earlier in your response, you mentioned that you are not happy about the current status of funding and research in Africa, especially West Africa. Now, I would like you to advise West African governments in terms of funding of vaccine production and research, especially Nigeria.
I think I'm still surprised because most of the organization that has been supporting the development of the vaccine for pathogen in Africa are not African organizations. They are still Western organizations. I think a couple of months ago, and I know that CEPI made a call out for uh, vaccine developers and everything. Unfortunately, either the proposal were good or not. Most of the proposals that came out from the from African countries were not funded because they can't really match up with the resources that their counterparts have from others. So for us to actually be serious, yeah, because we are not serious as Africa country. For us to be serious, we need to invest into our own health care, not waiting for a donor from the other continent to come and do that for us, because we will still continue to repeat the same mistake. Because if African scientists can receive funds from Africa to do it, then we have the technology within ourselves. I kept asking that now that in 2020 that we've been talking about technology transfer to Africa in terms of vaccine. So this is 2026. So for the 6th year now, the technology that have been transferred, what's at the outcome of it? Now Ebola is out. There is no leading institution from Africa that is leading the discovery. So the discovery still go back to the hero. So we need to see into this, and I know that maybe in future something good can come out. Actually, for me, actually losing hope in the African system because of the way the system is run. They have good hands and there's no full support for them to do better for this system.
Okay, let's be hopeful, Dr. Oladipo. Nigeria will get it right just as its counterparts. Your final words to healthcare workers and the public listening today to keep in mind regarding vigilance and prevention.
Yeah, people do say something that in my culture in Yoruba, that before the corn came into the world, there is some food that the chicken or the hen were eating. So even before vaccine comes into play, prevention is better than cure. So if there are other ways that you can prevent the pathogen, prevent infectious diseases, like looking at prevention, infection prevention control measures, please let us stick to it. Stay away from any risk factors that can put you to be infected of Ebola and other pathogens that are highly infectious. So health is wealth.
Health is wealth. Take charge of your health. Report symptoms early to the nearest health facility. Ebola virus is real. Dr. Kolawole Oladipo, we appreciate your time.
Yeah, thank you so much.
I have been speaking with Dr. Kolawole Oladipo, an associate professor of infectious diseases, molecular virology, and genomics. He is also the founder of Helix Biogene Institute. Sound Health continues with trending health report from around the world. Please stay tuned. The program is still Sound Health on Lagos Television. This is where we say thank you on today's episode of Sound Health. Remember, you and I can contain any disease outbreak. We all need to adhere strictly to all precautionary measures. Over 4,000 cases have been reported in the DRC and more than 2,000 deaths. We need to contain this as fast as possible before a vaccine is approved. For comments and inquiries, or you have topics you'd like us to treat, please send SMS to 0035 826603 or follow us on social media at Lagos Television, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.